Hello, everyone. Welcome to another exciting episode of Hardfire TV on Brooklyn Free Speech Cable here in the BRIC House in beautiful downtown Brooklyn. My name's Cameron Weber. I'm the producer of the show, and I'll be hosting today. Today I've got Paul Brown with me. Paul, thanks for coming back. And today we're going to talk about democratic socialism, single-payer healthcare. Paul is a semi-retired or not retired or whatever category you want to call theater and film producer, and has done some work in Alaska, which is a great, interesting place. We were there and saw all the melting glaciers, which was kind of sad. But let's see what else. So Paul and I did a show a few years ago on single-payer health. It's even more important now. Both Paul and I agree that what we have now is a cronyist system that was written by the health insurance companies and is a giveaway to them, and we can call that agency capture. Lindsay and Tellis have a new book called The Captured Economy, and people are becoming aware of the injustices of the way American capitalism is. The system, it benefits certain people over others, and that's becoming more and more aware in economics, in my field, in history. And so Paul and I agree on that. And but Paul is an advocate for single-payer healthcare, is serious about it, is a Vietnam-era veteran who has used the VA system. And Paul, you want me to ask you, what is the difference between socialism and not market socialism, but democratic socialism? So what's the difference between socialism, democratic socialism, and how does that difference relate to the healthcare system you envision?
Well, it's a very important question for right now because the word socialism is being talked about in the media a great deal and by some politicians and really carelessly. So
As
socialism
fear.
as we, and to exactly right.
Yeah. Fear is a big
To
thing,
stoke
part of
fear
politics.
in people.
Yeah.
So socialism, as it was in the Soviet era, was the means of production and industry owned by the state.
Yeah.
And in that system, there was no or very little private enterprise of
Underground.
any kind.
It's underground, yeah.
And it was largely undergrounded if it existed. To call what the advocates of single-payer health care, and I specifically am an advocate of Medicare for all, which you're hearing more about, to equate that to socialism is simply wrong. Democratic socialism exists, and healthcare systems exist within democratic socialism countries in many places in the world, among them the Netherlands, Denmark,
Single-payer systems?
Yes,
okay.
Germany and France. Germany is the largest economy in Europe. 80 million people, and everyone in Germany has health care.
Provided by the state?
Well, the systems vary in the ways that that they implement, and some combine some forms of the private sector. But what is most important is that everyone is covered in all of those countries.
Yeah. Equality under the rule of law.
So, unfortunately, within the industrialized world, the United States is the only country where health care is not a right.
Yeah. One sec, Paul. We're going to be doing a show this week on public goods, on how the public goods have become an ever-enlarging category. The larger the state gets, the more things that are considered public goods, healthcare being one of them now. The original public goods, as defined by Alexander Hamilton in Federalist Number 10, is the protection of property rights through the court system. That was the original public good, but now it's been expanded extensively. Sorry, thanks.
So we go back to the Federalist Papers, but you can also go back to Jeffersonian democracy, which was on the other side. But not to get caught up in the interest of time with history. Let's talk about the difference between what the system we have right now under the Affordable Care Act, or Obamacare as it's called, and what
It's the opposite of affordable.
what I'm advocating under Medicare for All.
Yeah, yeah.
Medicare for All would eliminate what the big wasted costs are, and that's the insurance companies
Yeah.
and the huge profits of the pharmaceutical companies.
Right. And all the paperwork.
And it would
that's
guarantee,
involved.
and the administration.
Oh, yeah.
Now, you mentioned paperwork. In the current system that involves the insurance companies and people who have to use them know how many times they're on the phone to insurance companies, the administration costs now are about 12% of the total. The estimates under Medicare for All would be to bring the administration cost down to 2%.
Yeah, because there's just
In
no
that,
paperwork.
there is an enormous amount of savings. And
Right, Paul. There's three, at least in my knowledge of it, there's 2 or 3 clerks doing the paperwork for the insurance companies and for the Medicare and Medicaid for every physician, for every healthcare professional. There's 2 or 3 clerks.
At the same time,
Yeah.
that 87 million Americans either have no coverage or they're underinsured.
Yeah.
So what we have is we've got high administration costs. We have huge profits in both the healthcare industry and the pharmaceutical industry.
Above normal
because we-
profits.
Well, we're paying more in the United States for pharmaceuticals than almost anywhere else in the world, and probably anywhere else in the world in the developed world.
Yeah.
And what
FDA for that. Thank you.
and-
Capture.
and we're not getting very much for it. So that's a beginning place of looking at why a single payer or Medicare for All system that is being proposed by many people. Most people identify this, and they should, with Bernie Sanders, who is in the lead with it, but he's by no means the only person. There are many people, and some of them are in Congress, who are advocating it.
Sure. What we have is broken. So
It's very broken.
let me ask you this. Under your vision of a single-payer Medicare thing, would private markets be allowed, or would they be driven underground?
So they would not be driven underground. Anybody who wanted to buy insurance
Okay.
that they cared to for some
Right.
kind of reason,
Sure.
they'd be allowed to do that.
Yeah, so it's not
Most
socialism.
but most people wouldn't want to,
Yeah.
because in a Medicare for All system, you would not have premiums, number one,
Yeah.
and you would increase the coverage over what you have. Eye exams, hearing aids. Medicare for All proposes dental care, which no one has unless they're paying a lot of money for it today.
Let me ask you this. Paul, I went to my dentist the other day, and when you and I were planning this show, and I asked my dentist, who I've been seeing for about 15 years now, I said, and his son is now there, and I said, "Are you going to be retiring soon? Should I meet your son?" And he said, and I said, "Well, what do you?" And then I said, "Well, what do you think of single-payer dentistry?" And then he said, "Well, at that point, that he would retire."
So there are people, and I know dentists and I know doctors who are quite happy with the current system. They're making a lot of money. However, the second largest association of doctors in this country, 2,000 doctors, just came out for Medicare for All a week or two ago. There are plenty of dentists who also see the injustice in the current system.
Yeah, sure.
They should be paid. They should be paid well.
Yeah.
And so the real objection, though, to Medicare for All is not coming from the doctors and dentists. It's coming from the pharmaceutical industry and the healthcare industry and the mainstream media. And here's why. In 2018, in television advertising on the networks and cable shows,
Sure.
$5.9 billion was spent.
On
So the owners...
pharmaceutical company ads you mean?
No, this is television advertising just for the healthcare industry.
Oh, okay.
Add on top of that pharmaceuticals.
Yeah, of course.
So there's and then
Hey, Paul, were we going to talk about intellectual property in pharmaceuticals? Was that part of what we want to talk about today? About how intellectual property is abused by the FDA and the pharmaceuticals in order to keep those profits? Do we want to cover that today or not?
I don't think so. I think that's a subject all on its own, and quite
Okay.
honestly, I don't know that I'm the person best equipped to talk about that one.
Yeah, that's a complicated. Yeah, that's all part of the problem. Also, is that the state does not negotiate with the pharmaceutical companies for competitive prices.
Well, that part of it is easy to answer.
Good.
In the VA, by the way,
Yeah.
the VA system does negotiate with the pharmaceutical companies. So if we want something of a model for Medicare for all,
Right.
we can look at the VA.
Yeah.
I've been in that system for over 30 years, and I can tell you that I'm a healthy guy today because of the VA. Last week, I needed a prescription. My copay was $8.
Okay.
If I had to buy that, if it had not been covered by my for-profit health care cost, it would have been a tremendous amount of money.
$25,000.
So I don't know.
Yeah, the way
well,
it is
varies. It varies. But to
tax the rich.
go ahead. You had another question.
Oh no. That was well, back to a question for you. Last time we talked about technological diffusion under a single-payer system without, for me as a free market economist, without a profit motive, without an incentive for creative destruction or discovery, that there wouldn't be any new technological discoveries under medicine. In other words, I'm your doctor, or you're my patient, or vice versa. I have an incentive to maybe discover a new technology working with you.
Medicare for
but,
all.
But if it's all planned,
Medicare for all is not dealing with how with research. That's a separate question.
Okay, right. Good.
What Medicare for all is
that-
dealing with is the delivery system of health care to the American people.
Right. Research versus delivery
And,
system. Yeah.
So, aside from that, I don't happen to believe that research, somebody being interested in research, in fact, the researchers for the big pharmaceutical companies are not making profits at it. They're paid and paid well. The thing I think we have to look at is the owners and why the owners are so much against a Medicare for all.
Owners, you mean equity
Owners,
holders? Stock market holders?
Let's start with the corporations.
Uh-huh.
The corporations are owned by stockholders.
Sure.
Their CEOs are paid enormous sums.
Yeah.
So they have, I think, a very selfish self-interest, indeed greedy in many cases, to keep the system as it is.
Including the intellectual property rights.
And what is happening is that the mainstream media, they all work for these owners, and so so getting really fair information out about what Medicare for all does for the average American, in fact for all Americans, is very difficult. However, there is a new study that comes out of Yale University, just released last week, in the magazine Lancet, which points out that Medicare for all would save us $450 billion a year and save about 65 or 70,000 lives a year. Healthcare, I believe, is a human right, because when you stop and think about it, for anybody to not be able to get the health care they need because someone can't make a profit at it is really barbaric. And we are the only country in the developed world that is operating in that way.
So this is democratic socialism you're talking about?
Well, now I'm getting into so within democratic socialist companies, look, corporations exist in Finland.
Oh, yeah. With low corporate income tax. The Scandinavians known for having low corporate income tax. We talked about that last time, too.
Well, this would be true in many, many countries.
Yeah.
But I want to point out a difference, something that is also being talked about in a way that, becomes not true, to get right to it. And that is the proponents of the existing system or a
vested
public
interest.
option to the Affordable Care Act
Yeah.
keep saying that under Medicare for All, your taxes are going to go up.
Uh-huh.
For people who are earning $80,000, $90,000 a year, family of four, their taxes might go up minuscule amount, but the amount of money that they would save by no longer having to pay insurance costs, all the things that are not covered in insurance, and the lower amount of pharmaceutical costs, or would mean that that for most Americans, while they would pay a little bit more in taxes,
That's
they'd
honest.
be saving a great deal of money under Medicare for All.
Let me two questions. So what exactly is this idea of a public option? What's that? An existing system with a public option. What's that mean?
Well, it means that if you want to keep, what the proponents say is that if you want to keep your your private health care insurance you have right now, you can have it, and the government will add a public option, meaning that we will cover more people who don't want it or can't afford that. The problem with that is that it still keeps the insurance companies and the pharmaceutical companies in the driver's seat.
Right. I hear you.
And that is look, that's what Obamacare tried to do. The good part of Obamacare is that there are many, many people now who are covered that were not covered. And that means lives saved. But again, to repeat it, 87 million Americans either have no health care or are underinsured.
Okay.
Only in America, one other point, only in America do you go bankrupt because you can't pay your medical bills. It does not happen anywhere else in the industrialized world, regardless of what the system is.
Okay. So thank you on the public option, and then also I wanted to ask you about the Affordable Care Act. I don't know if you've thought about this or not, but so right now, if you're a company that has 50 or more employees, then you have to buy health care insurance for your employees, and then you can write that off on taxes. Where if you're a sole proprietor, individual, not a corporation, which some of that 87 million figure you mentioned of the uninsured or underinsured, like myself, 30 million people are self-employed or don't get paychecks, right? And we can't write off our health insurance on taxes as can large corporations. Have you thought about that? Or
well, here's what I think is even a larger point than the one that you're talking about. You may be lucky enough to be working for an employer where the employer where you're offered health care insurance. And the employer, it may be paying a portion of that. However, you're paying the average cost for a family of four in the United States, according to the Kaiser Foundation, is over $20,000 a year in premiums. Think about that for a second. But then wait a minute. What about when you lose your job? You lose your job, or you're staying in a job you hate in order to keep your insurance. But if you lose your job, there goes your insurance. Now you're back in the struggle area looking for a way to get covered. You may or you may not get covered.
Or what you can do, if you're lucky like us, live near Chinatown, you can just go and pay $50 to see a doctor in cash.
Yes, in some instances, I suppose that's true.
Yeah.
But the larger question is the numbers of people who are going bankrupt when they have a serious illness by the things that insurance companies find a way to not cover.
Exactly.
The whole idea, the reason I think that the current system is barbaric is that the insurance companies are looking to see how few things they can cover. That means that you have an illness And
Yeah.
very often you're fighting in the midst of a very debilitating illness. You're fighting with insurance companies to get something covered, or you're back and they don't cover it, and so you've
Yeah.
got the bills.
Yeah, it's either preventative or remedial, right? And
Look
they
at the
change it back
expenses
and forth.
diseases. Heart conditions can be very expensive. Cancer is the one that is bankrupting more people than
Yeah.
any other.
Well, that's 'cause we're living
Diabetes,
longer, yeah.
it goes on. But the question of why, you implied or suggested earlier, why should the government be involved in the first place?
Yeah,
Let's stop and think about what happens when somebody is sick and they don't have health care.
why not food? Why not make
Well,
food
wait a
a
minute. Let me
public
make
good?
this point first.
Yeah.
If I'm sick because I don't have health care and I go into a grocery store, am I only sick by myself, or am I likely to be a contaminant of somebody else?
Yeah, that's a public health
If my
issue.
children
that's a serious
are not
issue.
vaccinated,
There you go.
they go into school with other children,
Yeah.
and they're likely to get disease. So the common good is
So-
what I'm getting to.
Yeah. So Medicare or single-payer Medicare for all would then, you're saying, reduce the likelihood of infectious diseases.
It would reduce infectious diseases. It would also have a component. One of the things that I did admire about the Affordable Care Act was that there was an emphasis on preventive.
Yeah, right.
There was an emphasis led by Michelle Obama at the time to try to encourage people to have healthier habits, eating as an example, to lessen disease.
Yeah. I see.
That
We see each
kind
other
of
at the
public
gym all the time.
education, that kind of public education needs to continue.
Yeah.
But I want to point out something else about Medicare for All. In Bernie Sanders' Medicare for All proposal, dental would be covered.
Yeah.
It should be. If you have a serious dental problem, you have a health problem.
Definitely.
It's going to lead to other diseases.
Even Louis the XIV didn't have dental. Wait, Paul. We just have like 3 or 4 minutes left. I wanted to ask, can you get more specific? How can we reduce pharmaceutical medicine costs under a single payer?
So
how is that going to work?
under single payer, the government would negotiate with the pharmaceutical companies,
Okay.
and so
Allow-
by getting together, the government essentially would drive down the cost because they simply wouldn't allow pharmaceuticals to charge the amount that they do right now. All we would be trying to do is to bring ourselves in line with our neighbor to the north, Canada.
Yeah.
Pharmaceuticals in Canada are a very small fraction of what they are here.
Yeah.
Do you realize that many, many people, particularly from northern states, cross the border
Yeah.
and buy their drugs
Sure.
in Canada? Because
I
of
buy
the
mine in
cost here?
Mexico.
Well, yeah.
And my father did too, buy his cancer medications in Mexico. Okay. Yeah, pharmaceutical cost is a big thing. Let me ask you this: in the VA, healthcare, like anything, except perhaps air, even fresh air, is a scarce resource. It has to be allocated somehow. Wouldn't there be a lot of waiting involved if you had a single? In other words,
Look,
wouldn't
I've
time be the
been
cost?
in the VA system now for 30 years.
Like at the swimming pool across the street, it's free, but the line is an hour long. You know, yeah. Keep going.
I've been in the VA system for 30 years, and I can't say that it's perfect. But I can tell you, and I talk with a lot of veterans, not only in the New York area,
Yeah.
where we have 2 very good VA hospitals, one in Manhattan and one in Brooklyn, and I don't know the one in the Bronx. But I talk with veterans in lots of places, including you mentioned Alaska.
Yeah.
And most of the veterans that I talk with are glad for the care that they have and like the system.
Yeah. Alaska's a different.
I don't have to wait very long to get an appointment, except in very unusual circumstances.
Do you have the same doctor over and over again? Or?
Yes, I've had the same. I've had the same primary now for about 4 or 5 years, and I like her very, very much. She will give me a referral to a specialist anytime I need it. Now, doctors do a very good job in the VA of questioning a patient and looking at the records, and not necessarily approving every request by a patient, because in any place there will be those people who want to take advantage of the system, but that's a very small amount of the overall cost.
Okay, great. Paul, you were definitely have done a lot of study on this in the last 2 or 3 years as we talked about it. I like the difference between the research and the delivery components. Research, we still have to figure out how you're going to diffuse technology through. But so we've got 1 minute left. Do you want to just say anything before we sign off? And thank you for coming on our show and talking about SinglePayer.
I would like to remind people that who are worried about their cost going up in a Medicare for All system, that once again, even if they were making $100,000, they'd be paying a little bit more tax, but people down lower than that would be under $50,000, wouldn't see their taxes go up at all. But the big thing is that they would no longer be paying insurance premiums.
All right.
That's the big thing.
That is the big thing.
And when you look at the two, when people are paying $20,000 and more a year for a family of 4 for insurance, and that gets eliminated, you've got a raise.
Great. Paul Brown, thank you for coming on the show. Thank you for watching Hardfire TV on Brooklyn Free Speech Cable. My name is Cameron Weber, and we'll see you next time. Thank you.
Thank you for having me.